Discussing matters health, and today we talk about your child's dental health, dental care really. And well, your child has been on the whole long holidays, probably been feeding on some whole junk, some sugary stuff. But what you really need to know on this conversation, Dr. P.J Muriuki joins us this morning. Karibu sana.
Asante sana.
First of all, as we talk about the whole child dental care, you can tell us more about what it means and walk us through the dental formula of a child when they're born, all the way until they're about 18 years. How does it progress and all that?
All right. Thank you very much. And I'm happy to be back speaking about dental health. Mm-hmm. So basically, when we are talking about children's teeth and how to take care of their teeth, we have to start from when the teeth form. Because the tooth is one of the very few parts of the body that does not regenerate once it forms. So meaning that we have to take care of it all the way from the time that it is formed. And it would be interesting for the viewers to know that teeth formation starts in the first trimester of pregnancy. And when we say about tooth formation, we are talking about the mineralization of the tooth, because the tooth formation process starts with a tooth as a tooth bud, the way you can have like a seed. Mm-hmm. So then the tooth forms inside the bone, and only when it is fully formed, just part of the root remaining, that's when it comes into the mouth. So during that mineralization process, if there is any interference, be it some unwanted chemicals like fluoride and things like that, then it will affect how that tooth is going to erupt into the body, into the mouth. So, but basically, we have two sets of teeth. Of course, when a child is born, they'll be born with the milk teeth. And then after some time, some of those teeth will start coming off. There is a schedule for that. And then eventually now we have what we have, the permanent dentition.
Let me take you back to what you were mentioning, the high intake of the fluoride.
Yes.
For this
teeth.
Fetus,
yes.
Before now becoming a baby, before
yes.
being born.
Yes.
Is it now from the intake of the mother intaking high levels of fluoride?
Yes, that's correct. That's correct. So because tooth is formed of various minerals, calcium, phosphate, and all those other things. But now when a mother takes water that has high fluoride, of course the baby feeds from the mother. So the high fluoride is able to pass to the baby through the umbilical cord, and it will be in the baby's circulation, and therefore when the teeth are forming, the high fluoride will be deposited on the teeth, and by the time they are getting born, because the teeth will have already formed, those teeth will erupt, being affected and having dental fluorosis.
Right.
Yes.
So you now, as you continue now telling us, after being born,
yes.
How many teeth, baby, as a baby,
yes.
progressively, you can probably start with under 3 years old,
yes.
also 3 years, between let's say 10 years and 10 years to around 18 years.
Right.
How all that progresses?
So like I said, we have 3 sets of teeth.
Yeah.
We have, I can classify it as 3 stages.
Okay.
So we have the stage where we have deciduous dentition, or what we commonly refer as milk teeth. So milk teeth, again, erupt in different stages. So not all the teeth come at the same time. So when a baby is born and actually, it's good that you mentioned that there are some cases where a baby is born with teeth, all right? So these are called neonatal teeth. Some of them are real teeth. Others are what people call plastic teeth.
Oh, the plastic.
All right. So in some cases where the tooth bud is very superficial, then you find that either when the baby is born or the time around when they are born, the first month, you'll find that they have a tooth which is coming in.
How common are the plastic teeth?
Not very common, but it's not unusual. So the prevalence, I don't have the exact statistics, but yes, they are there. So
if a parent sees the child with the plastic teeth, should
yes.
they be worried?
Yeah, actually not really worried. What they should do is they should make sure that they consult a dentist, because there are cases where those plastic teeth are very mobile and they need to be removed. Again, there are some precautions that have to be taken, including making sure that the baby has vitamin K and all the other things to ensure that they don't bleed too much. So in cases where it's very mobile, it has to be removed. Why? Because it's a risk. The baby can aspirate that tooth and it chokes them. All right?
Okay. So they actually lose, and even for the context of somebody who's watching us and they're wondering, because when you mention something plastic, it tends to be a little softer than when, if I, just touching my own teeth.
Yes.
They're hard, and I'm pretty sure due to the whole calcium and all that.
Yes.
But then, is it the same for plastic? I mean, how soft are they, and how loose are they, even on the gums?
All right. So the plastic teeth are usually not as firm and as solid as a natural tooth. So, and that's why we are saying, in cases where the dentist is able to diagnose that this person has, or this baby has plastic teeth, then that tooth might need to be removed because they are very mobile, they are not a real tooth, and they pose a risk in terms of aspiration. Because remember, when the baby is feeding, it is more or less suckling. So there is pressure which is being generated. So that pressure can dislodge that tooth and it can choke the baby. But in some cases, and actually I dare say most cases, you find that it is a natural tooth. Okay. It is a real tooth. It's only that the tooth bud was so superficial. Right. So where that tooth is assessed again by the dentist and they find that it is a good tooth and it is a natural tooth which is not posing any risk to the mother or the baby, then it should not be removed.
And some of the questions that even a mother would ask is, did I do something wrong during the whole pregnancy time? Did I take something that I shouldn't have so that now my child has plastic teeth?
Not really, not really. It's mostly nothing to do with what you do or what you don't do.
Okay.
So it's something that should not worry any mother. So long as they're able to access the services of a qualified dentist, they should be able to get sorted.
Right. Now that you've walked us through all that and the whole stages of the same, now let's get into the clinic. Before we actually now get into the elephant in the room and the whole dental problems and the diseases. So even all these stages, the kind of cleaning, so that you have this baby, either the whole plastic teeth or just without any teeth. How does the whole cleaning of the dental and the oral bit, the teeth, inside the mouth, the tongue, everything, all the stages from being a baby under 3 years old to around 10 years and proceeding further?
All right. So, and just to take you back a bit, so we have the milk teeth, which we call the deciduous teeth. So they usually are from the first year of birth, mostly around 6 months, all the way to around 5 years. So they are meant to be 20 teeth that will erupt at different stages. So that is the milk tooth or the deciduous stage. Then we have another stage where we call mixed dentition. Mixed dentition is where we have milk teeth and the permanent teeth. So this is where the baby starts exfoliating some milk teeth that start shaking and they fall off and they are replaced by what we call the permanent teeth. Then from around 12 years, all the way now to adulthood, we have what we call permanent dentition. So permanent dentition are teeth that are meant to serve you for the rest of your life. So when it comes to cleaning, we normally say that you should start cleaning even before the teeth come into the mouth. When the baby still has the gum pads without any teeth. So what you should do is, because brushing is a habit and it takes you getting used to it. So even for the baby, immediately they finish suckling, we advise the mother to take a clean cloth and just rub on the gum.
No toothbrush yet?
No toothbrush yet.
Okay.
Actually, the baby has no teeth. But that gets the baby used to the thing of brushing. Then when the first teeth appear in the mouth, normally around 6 months, they should make sure that they brush, not brush really, but wipe those teeth after every breastfeeding, especially at night. The reason why we say this is milk or breast milk has a lot of sugars. It's lactose sugar. And when this tooth is exposed to this environment where there is a lot of milk in the mouth, it can easily start getting decay.
So at this point, the mother is using, or the guardian there, is using a clean...
Yes, a clean piece of cloth.
Should it be dry or just damp?
Just damp.
Okay.
with just some water. Just put some water and then just clean the teeth, because it removes, the sugars, and the sugars are what causes dental decay.
Right.
So even babies' teeth actually get decay, and most mothers will come and tell us that the teeth are breaking off. Mostly it's just because of the breast milk.
Decay 6 months.
Yes.
Okay.
Yes.
All right.
So then, as we approach 1 year, by the time we are reaching 1 year, that's when the baby should have their first dental visit. All right. So because this time they have a set of milk teeth, and they need again to get used to going to the dentist. And
so
again,
as much as even they
don't have any problem.
They look healthy.
Yes, they don't have any problem. They look healthy. We have a bad culture of just going when things are bad to seek oral health services.
Yeah.
Actually, by just going, some of this information that we are giving on this show, you'll be given by your dentist. And this information will even help in prevention of some of those oral health conditions that happen. You'll be more of doing of promotive and preventive dentistry, and it will save you a lot of money rather than when you're just coming for curative services. So by 1 year, you can introduce the brushing. Of course, again, you should use fluoridated toothpaste, not non-fluoridated, but what matters is the size. You should use very minimal toothpaste, very, very minimal, a pea size.
A pea size,
pea size, of toothpaste. Because again, remember, toothpaste has a lot of fluoride. And babies, they don't know how to spit, right? So just a little, and in some cases, we even tell you don't use toothpaste. If you, it's not a must, all right? But we recommend that you use toothpaste, but very minimal amount, because the babies sometimes swallow. And remember, you're saying fluoride, when swallowed, is dangerous. Can cause dental fluorosis. So very little, just get the motions right. And this time, remember, it is the parent who's doing it. Still, you can continue if the baby is breastfeeding, especially at night. Still use your warm, your moist cloth to wipe the teeth after breastfeeding at night. And
so this is at 1 year.
Between 1 year all the way to 3 years, you alternate this cloth and brushing until the baby is able to tolerate the brush in the mouth.
How about the softness of the brush itself?
Yeah, it should be just a soft brush, because the gums are very tender, so you don't want to use heavy forces, and you don't want to use a brush that is very, very tough on the gums.
Right.
So then, as you proceed to a baby now who's grown up, who's 5 years and above, again, we still recommend that as much as the baby is brushing, they can brush in the morning, then the parent helps them to brush at night. Because the most important time for brushing is at night, because during the night, you are not talking, you are not using your teeth. That's when all the bacteria are having a party in the mouth, because of the food leftovers.
Right.
So we have to make sure that we brush, because that's when most of the damage usually happens, at night. So the baby brushes in the morning. We're talking of a baby who's 6 years, 7 years. Then at night, the mother at least helps to brush before they go to sleep.
Okay, continue.
Yeah. Then, of course, now someone who's above 8, 10 going on, this is someone who's developed some manual dexterity, so they're able to brush on their own. But then again, we still insist on supervision. And the underlying point here is that they should be visiting the dentist at least twice a year, just for checkup, to make sure that there is nothing that is happening.
So after every 6 months.
Yes.
So between the age of 6 and because at this point, 5 there to around 8 years, you've told us that they brush at night, as well as twice a day.
Yes.
But preferably at night.
They brush twice a day. But assisted brushing. So where you are also supervising.
Right.
So they can brush in the morning, then you brush as a parent or the guardian, brushes at night. Brushes them just so that if they didn't brush well in the morning, you're able to correct that in the night. The same way you cannot tell them to wash their clothes. They might wash the cloth, but it will not be clean. Yeah. So you have to supervise to make sure that the collar is well done and stuff like that. So the same thing with brushing. So you make sure that you supervise to make sure that they've brushed well.
Right. Yes. So at age 1, we have a pea-sized the toothpaste.
Yes.
On the same. Yes. And now for between age 5 to 8, do you increase the amount of toothpaste that is used on the toothbrush for this child? And also, when you take a look at around age 6, 7, 8 there, this is someone who's probably around grade 3, and they're quite common to use and to ingest toothpaste.
Toothpaste, yes.
Yes. So tell us about that.
Yeah, so it's a big challenge because some of these toothpaste are, they feel palatable, especially to kids.
Yeah.
So again, it's the knowledge gap. So they need to be told that it is dangerous to do that. Then secondly, again, the size of the toothpaste. It's a common myth or a common practice where you find people just flooding the whole surface of the toothbrush with toothpaste, even adults. That is not what we recommend, just a little, because...
Ndio meno ing'are.
This is just a cleaning agent. It's not the brush is the one that is doing the cleaning and your hands. So this is just an agent. So you don't need to flood it with a lot of toothpaste. So again, these babies, they should be supervised. Like we said, that's why we said until they're around 10 when they can comprehend some of these things.
Yeah.
So you supervise, make sure they use very little toothpaste because fluoride is important. And we usually say the fluoride can be an angel or a devil. It's an angel when used topically, meaning you're just using it on the teeth. And that is why we highly recommend fluoridated toothpaste. The problem is it becomes a devil when you swallow it. So either through borehole water or all the water sources or even swallowing the toothpaste. That is now when it will affect the teeth and your bones. So it will cause what we call dental fluorosis, where the baby develops brown teeth, and also their bones get weakened.
Right.
So the size of the toothpaste should just be very minimal, not a lot, and then they should be told not to ingest the toothpaste. Yes.
So now we're at age 10, and even for a child who's listening to you this morning, as they continue taking their breakfast. So at age 10, we'll assume that this child doesn't really need the whole supervision of even how to brush their teeth. But then walk them through how they actually brush their teeth, because there's a whole brushing the teeth, as well as the gums, as well as the tongue. They probably see the adults in the house doing all that until mtu amebrush hadi at the back of their tongue.
Yes.
Until they actually feel like getting choked. Walk us through, should a child also do the same criteria of brushing the whole mouth like that?
Yes. So actually there's a song we used to sing in primary school, that you wake up in the morning, you brush your teeth, and I think you eat your breakfast and then rush to school. That is not the way it's supposed to be. So what you do is you wake up in the morning, take your breakfast.
Shouldn't be before?
No.
Oh, okay.
You take your breakfast, then after breakfast, take your brush, just put a little toothpaste, just a little, and the brush that we recommend is a medium size toothbrush. So you just put a little toothpaste and you brush your teeth. So brushing the teeth is, I wish I had come with the models and all that.
Yeah.
But basically we want to brush all the surfaces of the teeth and all the teeth. So most times you find that kids will just brush where you can see, and then they just come and show you that I've brushed my teeth.
Yeah.
Remember, we have teeth at the back, the molars, and those are the most susceptible teeth for getting cavities. Why? Because of their anatomy. They are big teeth that have a lot of grooves and fissures. So those grooves and fissures, that's where the dirt usually hides itself. So what we want to do is we make sure that we brush. If this is your tooth, you're just brushing the top surface, the the inner surface towards the tongue, and also towards your cheek. So you're brushing on the outside, the biting surface, and also towards the tongue. Then when it comes to the front teeth, again, you brush where people can see. That's the outer surface of the teeth. But also remember the inner surface of the teeth, all right? The whole brushing process should not take less than 2 minutes. People just put the brush and then they're out. It should take at least 2 minutes, where you're able to touch on all the surfaces. Then you should angulate your brush in such a way that some bristles are passing through the gap that is usually there between the gum and the tooth. there is usually what we call a periodontal pocket. So it's a pocket that is usually just the way you have between your nail beds. There's a space that is there that is very notorious for packing food. So you angulate your brush 45 degrees so that the bristles are able to brush across the gum to remove any dirt that is there.
Right.
Then after that, you can now rinse your mouth, rinse your brush, and then now brush your tongue. You make sure you brush your tongue because the tongue also sometimes gets very dirty because that's where all the food is getting through. And it can lead to even bad breath, where you're brushing your teeth, but then you're forgetting to brush your tongue. Of course, don't be too aggressive. The more you brush it, the cleaner it becomes, and you don't have to spend a lot of force or, using a lot of time brushing the tongue. But it is very important that you brush the tongue. Then during the day, when they're at school, after every meal, we recommend at least you rinse your mouth with water so as to remove the debris. I'm very happy there are some schools that actually give kids brushes to brush after lunch. That is what is recommended, but where it's not practically possible, then you can use your water and just rinse in the or your teeth with the water. Then at night, brushing should be the last thing that you do before getting to bed.
Okay.
Like we said, during the day, there is a lot of movement. Your tongue is cleaning the teeth. There is a lot of saliva production when you are talking and all those things. But at night, you are at rest. So your mouth is not doing anything. So if there is food debris that is left in the mouth, remember the mouth has a lot of bacteria. So when these bacteria now have that food substrate, they'll produce a byproduct which will cause bad breath, will eat away the surfaces of your teeth, and you develop cavities. So basically, that is what should happen when we're brushing.
Right.
Yes.
Now, before we get into the whole corrections as well as the common problems when it comes to the oral bit and the whole dental formula of you as a child, remember you can call in live 0795 045 864. In case you're a child and you're watching this, and be a mom and be a dad, piga simu sahi. And even as you call us, tell us where you're from. Switch off your television, just mute it, and be as audible as possible. Daktari will be answering all your questions, or if you probably just have a thought or an opinion, you can also tell us. So do that. Our phone numbers are quite open. You can also text us, 22047 is our SMS number, as well as WhatsApp. You can WhatsApp us right now, 0793 267 279. So, Doc, because we've now established how everything really looks like, how you should actually clean it. Now, before you actually get into the kind of diseases that are there, the whole cavities and decay, walk us through also braces. Who needs braces, really? Because they're quite common among children. So who really needs braces? I think back then I used to see kids with braces, they really looked cool, but then who really needs braces? Does it reach an age as a child that the braces should come off and all that? Talk to us about that.
All right. So, yes, so braces are what is part of what we call orthodontic treatment. Orthodontic treatment is a discipline within dentistry that deals with correction of crooked teeth. All right? So these are teeth, especially permanent teeth, that have grown either due to lack of space or the size of the tooth bigger than the jaw. They are not able to fit in the mouth properly. And when teeth are not properly aligned, of course, it will affect your looks, your appearance. It might also affect your function, that is eating and speech, the way you talk. And basically, the facial appearance is affected. So in those cases, then you need to do orthodontic treatment. Now, orthodontic treatment is not just braces. There are so many other ways of correcting this malalignment or these problems that have to do with the spaces. Now, the issue of braces has become, commercialized.
A whole bunch of meeting.
So first of all, not everyone can be able to put braces. This is a specialty within dentistry, and someone requires additional training to be able to put braces, because it's not just putting the braces. What I normally say is braces do not correct teeth.
Okay.
It is the doctor who uses braces to correct teeth. So the underlying emphasis here is the knowledge and the skill of the person doing it. Putting braces, even you, Stan, you can be able to put braces. It's just sticking them on the teeth.
Right.
But how you stick them to the tooth, what position you put them on, what mechanics that you are going to use is what determines the success of the treatment. The unfortunate bit is we have very few dental surgeons in the country. We only have around 1,500 dental surgeons in the country. And out of this, only around 800 are actively practicing. Now, even for these dental surgeons, even me when I qualified, I had to undergo some additional training to be able to do braces. But now what you are finding is there are so many, let me just call them quacks, because when you are doing something that you are not qualified to do, then you're just a quack, right? There are so many people who are doing this. Some are professionals, yes, but who their scope of practice should not involve putting braces, all right? Now, the unfortunate bit is that these braces cause what we call irreversible movement of the teeth. So if these teeth move in the wrong direction, right, as much as you are seeing the teeth, correcting, there is a certain movement that they should go with, because you are not seeing where the root is. So if unwanted forces are applied on those teeth, what happens is the roots of those teeth can get damaged. And you as a parent or you as a patient, you will not see, you'll just see the teeth that are aligning, but you cannot see the root.
Yeah.
And sometimes you get resorption of the root. And sometimes you can even I've had cases of patients who come with mobile teeth after braces, because remember, these are forces that are used. It's only that you have to use certain type of force, and that is where the issue of the skill and knowledge comes in. So I would really advise parents that braces is not a must for every child. It's a treatment. It is not just a one-fit-all kind of scenario. It's a treatment, and there are very many different types of braces, and diagnosis is very important. The braces that I might have on myself might be different from the ones that you have on you and the other patients, and so on and so forth. So the most important thing that I'd say is not everyone should have braces, number one. They're not just there for fun. Number two, not everyone should be able to put braces. So you need, as a patient, to also make sure that you do your due diligence to make sure that the person who's doing this kind of treatment is qualified to do. And nowadays it's easy. We have a portal, the Medical Practitioners and Dentists Council.
Okay.
Yeah. So you just go in there and type the name of your doctor and see whether they are registered.
Right.
The person should be registered either as a dental surgeon or an orthodontist.
Right. Fantastic on that. Now, this particular age is one, and mostly, let's say, mostly particularly even for boys, they're quite, jumpy and all that. And chances of this, let's say, probably it's a 12-year, 13-year-old, either boy or even a girl, getting one of their teeth chipped is very high. What happens because even for a number of viewers, the parent wonders, huyu mtoto alitoka shule and one of their teeth was probably chipped off. What happens in this scenario? Should they just continue living that way? Will they be okay, or they can get a correction on that? Yeah,
it's possible to correct. If actually there is a myth that I always like demystifying, the issue of if there's a problem with a tooth, remove it. That is very backward. The way God made us is such that He wants us to go back with everything that He gave us. Same way you'll go back to Him with your 2 arms, 10 fingers. He wants you to go back with all your teeth. So that's beside the point. But if it is a fracture that has happened with the tooth, nowadays we have tooth-colored materials that we use to fix the tooth. And actually, I even dare say, even for milk teeth. Milk teeth, they have functions in the mouth. So number one is the appearance of the baby. Number 2, they help the baby to eat. And number 3, they preserve space for the permanent teeth. So this issue of people saying that milk teeth, if it has a hole or it has a fracture or it has any problem, should be removed. It should not be removed until its time to come off is due. Because what happens is, for example, if you remove a milk tooth before its time, what happens is that space closes. And when the permanent tooth now is ready to come out, it will not have the space for the, to fit in the mouth.
Right.
And that is where now teeth start growing from the side.
All right, thank you, Doctor. Let me take this call by Beatrice kutoka Syokimau. Beatrice, a very good morning to you.
Beatrice, good morning. Yes, endelea. Niko na mtoto approaching 2 years in July. In July 22nd.
Okay.
Na amemea tu meno ya mbele peke yake, anjamea zingine. So nilikuwa naona it has taken long. Na daktari alinihakikishia, daktari wa watoto aliniambia itamea tu with time, but naona it has taken long. So nilikuwa nauliza daktari kama it is in order meno kuchelewa after 2 years ya mtoto kumea.
So far kona ngapi?
Nani?
Mtoto akona ngapi sahi?
Akona 4 ya chini na ya juu.
Oh.
Na ako almost 2 years now.
Almost 2 years. Okay.
Yeah.
So asante sana Beatrice, salimia watu wa Syokimau.
Okay, nitawasalimia. Atajibu sahi?
Yes, anajibu sahi, anakusikia anajibu sahi tu.
Okay.
Yes. Asante sana. You can always call us live 0795045864. WhatsApp us 0793267279. We'll be going through them. But first, that question on the whole delay of the growing of mtoto.
Yeah. So, yes. So that's a good question. Now, like we said, teeth start erupting between 6 months all the way to around 3 years of age. And these teeth erupt at different stages. So the first ones to start are usually the incisors, the lower incisors, then you go up, have the upper incisors, then you have the canines and the molars, the milk tooth molars, all right? So now, she's saying that the front teeth, the incisors have grown.
4 of them.
4 of them,
Yeah.
and the child is 2 years, right?
1 year and a couple of months,
Yes.
heading into 2 years.
Yes, I'd say that she shouldn't be worried.
Okay.
Because the molars usually come in between around 22 months. That's about 2 years.
Yeah.
2 years to 3 years. So she should not be so worried. And their kids are different. There are kids that will grow even teeth at 3 months. And by the time they are 2 years, they have all their teeth in the mouth. So we see other kids who have a lot of delay that even go up to 4 years, especially boys. So she shouldn't be worried. However, there is a way that they can even take some pictures or x-rays to make sure that that tooth is there. But at this point, I'd say that she shouldn't be worried at all.
Right.
Yes.
So, but then now, to the whole, is there a point where she should now start getting worried? Does it get back to what you were telling us?
Yeah, around 3 years. 3 years, then at least now, not really getting worried, but they should check to see if those teeth are there.
Right.
Yes, because we have cases where we have some conditions where teeth do not form. It's rare in milk teeth. It's more of the permanent teeth. But at this point, for the sake of this parent, I'd say she shouldn't be worried. Let her just make sure she visits the dentist every 6 months, and they can be able to evaluate.
All right.
Yes.
Now let's get into the kind of the dental diseases that are there. Before we actually take a look at the kind of photos that I have, and you just analyzing them, really.
Yes.
What are the most common that you've experienced, and the kind of the rare ones? But before that, let's pick this call by Peter kutoka Nyeri. Peter, habari asubuhi.
Na pia kuuliza swali.
Yes, endelea uliza.
Niko na mtoto msichana wa miaka 5 hivi. Napoangalia meno yake yamedevelop brownish colorations. Nilipouliza daktari akaniambia kwamba shida yake ni venye ametumia amoxicillin sana. Kwa hivyo sasa meno yake ni kama they are being eaten away. My main problem is that my worry is that nashindwa hii meno yake especially kule nyuma ya molars na premolars huko. Sijui ningependa daktari anisaidie hayo yanakuwa permanent ama kuna mahali itafika itoke, kwa sababu nimeangalia nimeona ni kama imeanza ku develop cavities.
Okay.
So that one is worrying me and I don't know what to do.
Sawa.
Please you can help me in that.
Sawa. Doc amesikia swali yako, atakuwa anajibu sahihi tu. Asante sana Peter kutoka Nyeri.
Nashukuru.
Sawa, salimia watu wa Nyeri. Doc?
Yes. So thank you so much, Peter. Now, you know, it's difficult to give a very authoritative answer because I've not been able to review the patient and see. But from what he's talking about, there could be two differentials or two different possibilities. Number one, he's said that the child is around 5 years and the teeth are turning brown in color. And he's also mentioned that zinavunjika.
And particularly the molars.
The molars, right? So we could be having issues to do with the dental caries. Dental caries is a condition where teeth develop cavities. And this is usually brought about by the whole issue of diet and sugar, right? And lack of brushing the same. So when you eat very high sugary diet and you don't brush properly, then these teeth are meant to develop cavities because of that. So, and that is when now you start seeing the teeth breaking off, and there is also change of color. All right, they turn black in color and they start breaking off, and sometimes they totally break off. So you're left with a.
All right. Yes. Allow me to interrupt you. He also mentioned about amoxicillin. We'll get to that, but before that, let's pick this call by Mary kutoka Nakuru.
All right.
Mary, habari asubuhi?
Nzuri sana.
Watu wa Nakuru mnaendeleaje?
Wazima.
Yes, Doc ako hapa masuala ya meno na afya meno ya watoto. Uko na swali au maoni?
Nina swali.
Yes, uliza atajibu.
So my daughter last year around Easter alipata accident. So meno zake mbili zikatoka, one canine and one incisor. So this year early this month imeanza kutoka moja, na ni canine moja imetoka lakini imeziba ile space ya canine. So I'm worried like ikifika hiyo time ya canine kumea, juu kutendaje juu hakuna hiyo space.
Mary, how old is your daughter?
She's 5 years.
5 years, okay, sawa.
Yeah.
Umevisit dentist ama bado?
The time alianguka nilienda kwa dentist, so nikaambiwa tu ni chill, ningoje meno zitamea. But last week pia nilikuwa nimeenda hiyo visit. So nikaambiwa venye meno zinafaa kung'oka niende atolewe ile nilikuwa inafaa itoke ya kwanza.
Okay.
Ndio space isiendelee kuziba, but sasa tunaona the canine ikifika hiyo time ya kumea, hiyo space imeziba kabisa.
Sawa. Thank you very much Mary, salimia tu Nakuru. And asante sana for calling us. Asante sana. Daktari atakuwa anajibu sahihi tu. All right, remember you can always call us live 0795-045-864. The doc will be filling your questions on the same. Before we get to Mary's question, I hope umeshika vizuri. Nataka tumalizie ya Peter kutoka Nyeri akiuliza ile story ya the amoxicillin, telling us the 5-year-old child, the whole discoloration and particularly on the molar. And now you had given us different kind of scenarios. So there's scenario 1, but now the whole scenario 2 here, amoxicillin. Amoxicillin is a drug, I believe.
It's a drug.
Yes.
So it's actually related again to what I said about dental caries, because the problem is usually not the antibiotic itself, the amoxicillin. The problem is these antibiotics, they are usually mixed with sugar to make them palatable for the children. So, and because it's a syrup, once you take it, this sugary stuff is left on the teeth. So if you are not able to brush properly to remove this sugary coating from the drug, then the teeth are meant to develop cavities. The only medication that can cause discoloration of teeth when you ingest it is what we call tetracycline, especially when taken by a pregnant woman or a baby when they are young. Those teeth will come out looking grayish in color because it stains the teeth when they are forming. But when the teeth have already formed, even if you take amoxil, it's not the drug itself causing the problem. It is the way it is, it has some sugary syrup. So when you take, some of the syrup remains on the teeth, and that forms a substrate for the bacteria to start destroying your teeth. So it goes back to what we were talking about brushing. The other scenario for him could be the issue of dental fluorosis. Dental fluorosis is where you have brown discoloration of teeth because of water, taking water that has high fluoride. So these teeth characteristically have brown discoloration, and they usually break off. So they are usually very weak and they are breaking off.
Right.
So this is because of dental fluorosis. So what I'd advise Peter is that he visits a dentist so that he's able to diagnose exactly what is happening. And there are many, many solutions to these problems. It doesn't mean that once it happens, that's it. Now, coming to the caller from Nakuru.
Yeah.
So they had a child who fell down and one of their milk tooth came off.
One incisor, one canine. Yeah.
So again, what usually happens is, like we said, milk teeth are very important in speech, function in terms of feeding, and preserving space for the permanent teeth. So whenever you lose a milk tooth, when it's not ready to come out, then what happens is that space automatically closes. So when it closes, when the permanent tooth is ready to come out, it will not have space and it will start erupting from the side. And that is what people commonly refer as home. You know, home is not an extra tooth. It is your tooth which is growing from the side because the space where it was supposed to grow is not there. So for Mary, I'd advise that she needs to walk this journey with the dentist because there's something called serial extraction that can be done. Serial extraction means that when the canine is ready to come in, you can now remove the molar and have the canine fit there, and then you continue until all the teeth are accommodated.
So Mary, I hope umepata hiyo jibu. From Nakuru, let me take you all the way to Mombasa, pahali Valerie yuko. Valerie, habari asubuhi?
Nzuri.
Unakaa una furaha ribo kutoka Mombasa. Tuambie una yepi leo?
Okay, I had a question.
Uliza.
Niko na mtoto ako 5 years. She's 5 years, but she has a condition.
Okay.
She has cerebral palsy. So my question is, meno zake zote zimeoza. Alafu sasa nikiangalia zimeoza na ndani.
Okay.
Na she's 5 years. Niliambiwa zitakuja zing'oke, alafu zingine zile. But sasa naona anaelekea 6 years na bado.
Right.
So I was asking daktari, hizi meno zake sometimes analia, sijui kama huwa zinamuuma, haongei. Alafu nikikuja kwa kubrush, watu natumia soft cloth, but still siwezi fikia hiyo meno ya mwisho.
Okay.
Hawezi panua mdomo, nikamwambia panua, ama akipanua ananiuma. Sasa sijui kama kuna special brush ni labda inaweza wasaidia.
Okay.
Yeah, that's what I wanted to ask.
Sawa. Asante sana Valerie, salimia watu wa Mombasa pale uko, endelea kutazama TV47.
Okay, thank you.
Quite a loaded question, Doc, for you.
Yes. No, actually, it's a very important question.
Yeah.
It's about children with special needs.
Yeah.
So these children with special needs, she talked about the cerebral palsy, right? So most of the time you find that they have issues to do with manual dexterity, being able to, to move their hands and being able to brush. So these are children that need special attention, especially at home by the guardian. The moment the teeth start coming into the mouth, they need to be assisted in brushing, right? And again, the whole point of making sure that we brush in the morning and in the evening, and we make sure that we cover all the surfaces of the teeth. So for her daughter, most likely she's crying because she has what we call pulpitis, or pain from the teeth. And because she's not able to express herself, then the only way she can do is just cry. And she said that the teeth have broken off, and especially the back teeth. So what happens is when the outer layer breaks off, there is a nerve that is usually at the center of the tooth, and it's usually very, very painful. So what I'd advise her is that she needs to go to, she's in Mombasa, right?
Yeah.
If she goes to Coast General, there is a pediatric dentist who's there. These kids with special needs, you usually see them under sedation or under general anesthesia. So you take them to the theater and do everything at once. Where if there are teeth, and she should stop saying that they are milk teeth, they'll come out. Remember, they have a stage, and we cannot let this baby be in pain waiting for the permanent teeth to come in. So even if they are milk teeth, they need to be taken care of. And this is a point that I have to stress. Even a milk tooth that has a cavity and it is paining, if it is not ready to come out, it has not reached the time for coming out, there is a way that we treat it so that now it stops paining and you cover it so that it maintains that space.
So probably initially, was it a false analysis by the medic who told Mary that, or rather Valerie, that, zitangoka? But then, even as you hold on to that, let's go to Thika. Is it Mushiri? Mushiri kutoka Thika, habari asubuhi. Mushiri, habari asubuhi.
Yangu iko salama sana. Unanipata?
Yes, tunakupata. Uliza doc swali uko nayo.
Swali niko nayo, nilikuwa nauliza ikiwa mtoto amefika kiwango ya kutingika meno, hizo meno lazima zitangolewa zinaweza kungolewa na dento, ama lazima itingike ingolewe na mtu binafsi? Na hiyo meno inaweza ngolewa mbili pamoja, kama inatingika inaweza pelekwa kwa dentist azingoe pamoja mbili, ama lazima ingolewe moja kwanza igoje nyingine hata kama zinatingika zote?
Asante sana Mushiri kutoka Thika. Asante sana for all. Haya. Daktari anajibu tu sahihi. Doc, as we see, you have about 2 minutes to answer all these questions. Malizile Mary, as well as get your final thoughts. Before he called, I was asking now the whole analysis of that medic on milk teeth kungoka ndio sasa zingine zime vizuri, as well as now for Mushiri's questions.
Yeah, so it's a myth really. I mean, these kids can be attended to. Kids with special needs, they need to have a proper review because remember, nutrition starts in the mouth. So if you're not comfortable in your mouth, then you're not even able to feed. So I'd advise she goes and sees a pediatric dentist. They're available in our public hospitals. Then she'll be able to get sorted. The baby can be seen under general anesthesia.
Right.
For the Mushiri from Thika, yes, sometimes these teeth, we encourage them to exfoliate naturally, but in some cases where you find the other tooth is growing from the back, it means then they are not aligned and it might not be able to push it out. So then it can have, they can go to the dentist and have them removed. Okay. You can remove 2, 3, depending on the clinical situation. So it is okay.
Right.
So now,
your final thoughts.
On my final thoughts, I would say that it is very important that we take care of our teeth, and especially babies' teeth, because it affects their quality of life. We need to watch their diet, make sure that they are not taking what we call cardiogenic diet, a lot of sugars and all that. And if they take, remember to always brush. Then the other issue is that people should always visit the dentist. Nowadays we have public hospitals that have dental departments. I head the dental department or the oral health division in Nairobi County, and we have our facilities that have top-notch facilities to attend to them. We actually have we have the only pediatric dental hospital in East Africa at Lady Northey. All right, so they should go there, and the services there are free. And in Mama Lucy, we also have a very new dental and maxillofacial center where they should be able to get help with their dental issues. So they should make sure at least twice a year you visit a dentist. Don't wait until when you have a problem. That is when you are going to seek help.
Asante sana. And as the words that Nairobians understand,
lazima iwork. And if anyone has any other question, they can just get me on my socials. On Facebook it is P.J Muriuki, and also on Instagram is Dr. P.J Muriuki.
Right.
They can inbox. I know time was not adequate. They can inbox and I'll be able to answer their questions.
This conversation definitely continues on our digital platforms. Umepata hiyo yake. You can talk to him directly. Dental surgeon Dr. P.J Muriuki, asante sana for the wise words. Asante sana for all those who have called, akina Mushiri, akina Mary, akina Val, akina Peter, asante sana, and all those who have communicated to us on our digital platforms. This conversation, we put a pause here, and when we come back after this short break, we discuss matters fire safety. Kupale kwa nyumba, or even in the office, but then if a fire breaks out right now, wherever you are, do you know the first thing that you need to do? The whole fire drill, do you know? We'll be telling you all that. Jose Njuki coming up, don't go too far.
My name is Dr. George Washuri. I am here to present